Today we have a lovely guest from the physio department, and she is a specialist in physical medicine and a rehabilitation specialist, Dr. Salima Qudsi. Lovely to have you here.
Hello, nice to be here.
All right, so let's start with, tell us a little bit about your role and your specialty and a little bit more about what it is that you do.
Many people don't know what physical medicine and rehabilitation specialists do, okay? The purpose of our specialty is to help people recover as soon as possible to go back to their normal life after a sport injury, after an accident, an amputation, or any surgery that gives them a disability, and we help them recover as soon as possible to go back to their normal life.
Given what you mentioned, so when patients first come to see you, what is it that you look for or typically assess in the first session?
The first assessment, we have to examine the patient, okay? And first of all, we need to get information, all the information we can from them. All the information they want to give us, and all the information is important for us as a doctor, okay, to help them after a program of treatment and a recuperation, okay? So first of all is an interview. I let them talk, I let them explain what's the issue, what's their goal, why are they coming, if they have pain, they don't have pain, they have limitations to do some activities or something. And after I ask all the questions that I need as a doctor that give me information to get a diagnosis and to do a treatment, a proper treatment, okay? After that, I do a physical examination, okay? Depending on what area, I try to examine to see the range of motion, to see if they're weak, their muscle strength is not okay, if there's any neurological issues, okay? And after that, in my mind, I do a differential diagnosis of the possible illnesses that the patient has, okay? And program a treatment that after the physiotherapist will do. So I explain the patient what I think they have and what are the steps we're going to follow after that.
That's amazing. That is a really amazing strategy. So I heard you deal with a lot of complex cases. And so my next question to you would be, how do you deal with pain that's not really going away just with standard treatment?
Pain is one of the most difficult things to handle, okay? Because most of the times we don't know where the pain comes from. We don't have any blood test, any test that can say, okay, this pain comes from here and this is the grade of pain he has. It's very subjective. So each person experiences pain in a different way. Some people with the same illness, with the same pathology, some maybe have a lot of pain and some don't have pain at all. So it's very personalized, okay? This is very limiting because pain makes people avoid exercising or avoid things that they liked to do. They avoid going out. They avoid relating with people. So this is like a circle. I have pain, I stop moving, then I stop relating and I get depressed, and it's a circle that we have to try to break, okay? So it's very, very important to listen to the patient and at least try to help them as much as we can. As I tell you, sometimes if you don't know where is the etiology of the origin of the pain, it's hard to do a treatment, because if you don't know from where it comes, it's difficult. But there's always different, you can put medication, you can do physiotherapy, you can do nerve blocks, you can do infiltrations and things to relieve pain for this person to help them recover and as soon as possible go back to their normal life, okay? Maybe 100%, it's difficult sometimes to solve the problem, but at least help them to go back to their normal life and with a tolerate like a normal level of pain that they can tolerate and live with it.
Right, so I'm hearing the key thing is for you to identify the cause before anything else.
Exactly. But sometimes it's difficult to find the cause.
Yeah.
Sometimes you go to the surgeon and he says, okay, the knee replacement, look at the x-ray, it's perfect. There's nothing wrong. So he comes to me and say, okay, the x-ray is okay and your physical examination is not that bad, but I don't know where the pain comes from, okay? So you can do a differential diagnosis of which are the different causes that could cause the pain, okay? So you have to go discarding, ruling out one after the other. So first of all, you have to say that the surgery is okay. After, you have to see that anatomically his movement is okay, because maybe he's weak, that's why he has pain. So you have to strengthen this limb to improve stability in the joint and maybe avoid pain. Maybe if you sleep the nerve that causes the pain in this joint, you put anesthetic or cortisone in this nerve that's causing the pain in this joint and you sleep it. And when you sleep it, the pain relieves. So you have to try to rule out one by one the possible causes of the pain.
So in your personal opinion, when would be the time to consider an injection or a PRP in your standard treatment?
I don't like to be invasive from the beginning. So the least invasive we are, the better. Okay?
Yeah.
So we always start from the lower things. So for example, if you come with lower back pain, okay, first to examine you, see what are the causes. We ask you all the questions we need to get all the information and make a differential diagnosis of the possible things that could be causing this pain, okay? After, once we have this, we see if we need any tests or things, okay, to help us go more in detail into the diagnosis, okay? After that, we start with physiotherapy, okay? Physiotherapy would be the first step, okay? If with physiotherapy we see that there's no improvement, then we start with maybe medication and physiotherapy. If with medication and physiotherapy there's no improvement, or the physiotherapist can't really treat you because you have a lot of pain during the session or you're limited, then we would go to an infiltration, okay? Infiltration is inject. There's many things that we can inject. We can inject hyaluronic acid, anesthetic, corticosteroids, PRP or plasma-rich in platelets. So depending of what is the issue that you have, we would prefer or choose one or another, okay, injection. But that would be usually the last step, okay? Except if you come and you say, okay, this pain is not bearable and I can't live with it, then we will go directly to try to relieve the pain and then try to help you with physiotherapy, okay? So it can be or the last step or the first step if you say it's very limiting, the pain doesn't let you live or something. So we attack the pain and then help it with different options, with medication or physiotherapy or something else.
I like that. Attack the pain.
Yeah.
That's a good way to describe it.
Pain is one of the worst things I think people can experience.
Absolutely.
It limits your toothache. This pain is one of the worst ones, and it can leave you in bed. And it can come from just a tooth. So pain is something that we have to try and
take seriously.
And now we have a lot of techniques. Medicine is advancing a lot in this field. So we have to take advantage of this.
So I've heard that many people say they feel truly listened to in your sessions. And it makes me wonder what your philosophy is when it comes to treatment.
This is a very good question. I come from Spain, and I worked in a public system always. So we had a very important overload of patients. It's completely different working in a private sector. Maybe the overload of patients is not that much. So in the public system, you don't have that much time to give the patient because you have one after the other. You don't want to get late because then the other one is late, and it's a never-ending story. So the nice thing of working maybe in the public system, in the private system, is that you have more time to dedicate to the patient. It's very important to listen to the patient because they can give you a lot of information. They can express themselves. Sometimes they just need to be heard. Sometimes I don't do absolutely anything special in the interview with the patient, but just letting them talk, they say, thanks for listening to me because I went somewhere else and maybe they didn't pay attention to me or they didn't explain to me. I always think that we have to, we are doctors, okay, but one day we will be patients. So it's important to think, what would you like to feel when you're on the other side, okay? I always think that explaining to the patient, if they understand what they have, it's easier process to heal. And it's like if I go to a mechanic and he tells me there's something wrong with engine, I don't have no idea of mechanics. But if he goes and he shows me the motor and says, if this goes like that and this doesn't go here, the motor won't work properly. Then I will understand it. I won't memorize it. I will understand what's going on, and I will have more confidence actually in the doctor. So I think it's very important to listen to the patient because it helps them and it helps me to get information from them.
Well, that makes a lot of sense.
We never think when we're on the other side. Like, for example, I had my father. He had a health issue. When I was waiting for him to come out of the surgery, it's this anxious and things. So that the doctor came and explained me and gave me his time, this made me feel very nice. And so you have to always think, how would you like to be treated?
Exactly.
And so this is what I think it's important.
It makes a lot of sense.
But working in a public system is difficult, I admit, because you have a lot of workload. So this is what, it's not that the doctor is better or worse, it's workload that doesn't maybe let you express or have this time that you would like with the patient.
So from your perspective, Are there any misconceptions that people commonly carry that you wish more people know the truth about?
I think always we thought for example, you have a lower back pain and they would tell you, no, go in bed and stay in bed for 2-3 days, don't move and rest. And now it's all the opposite. So I would encourage people to move. If you have pain, you have to move. Of course, if you have a low back pain, you can't go on run, but don't stay in bed all the time. Encouraging movement heals the body faster. It helps the body recover sooner. It's for example, after a surgery, it's important to move. And every time, even hip replacements or knee replacements, the doctors are trying to move patients faster because it recovers your body faster. So I would encourage everybody to move, to do exercise. I know that somebody that's 20 years old can't move the same like one of 80 years old, but the goal is not the same. So maybe the one of 80 years old, just walking 15 minutes every day is enough. One of 20, I would like him to encourage him maybe run 20 minutes instead of walking. So I would say that usually we had this concept of, okay, you have something, rest. No, now it's totally the opposite. We have to try to move and as soon as possible because your body will recover soon.
I agree with you, actually. The older generations are starting to take this on and starting to understand the importance of movement. It's not just because that you are now elderly that, I won't move. That's when you would need it.
Yeah. We even, it's maybe our fault also, when we have our parents that are elderly, we try to do everything for them. And we have to encourage them to do the things. Even they take longer, it's not an issue, but they have to try to do everything independently. We want independent people. So you can see elderly people that maybe come from rural areas that they have to work in the land or things, they are way more healthy than elderly people that maybe live in the city and go everywhere in the car. So it's just proven that elderly people that move reach an elderly age and in a better physical condition and way more independent for a longer time.
The statistics show when you see places, I think it's Ikaria, it's an island in Greece, people live to 100.
Yes.
It's that.
Yes. It's going, planting your vegetables, walking everywhere, walking to the neighbor, everything, movement. So this is all for your cardiac system, for your muscular system, for everything, for your mental health. If you don't depend on somebody to do things, you're way happier because you're independent. So that's our goal, is to get elderly people, because we live longer now. Before 60 was very old. Now 60 is the normal age. You're starting to live. Okay, you retire at 65 or like this. So we want people of 80 healthy and independent. We don't want them in retiree homes or things that you don't want that. You want your father and your mother to be independent. Okay, absolutely. So I think it's encouraging to move.
So I've heard you've done a lot of humanitarian work, and some of that includes a little bit in Iraq, a residency in Palestine, and even working with refugees in Spain. I'd love for you to share a little bit about your experiences and whether or not that shaped or changed your perspective as a doctor.
Of course, that changes your life, not only how you face your job. These patients are completely different to the patients that you have back home. These patients, they trust you. They're very grateful. You don't have the sources that you have back home, but you try to use your imagination to help these people as much as you can. They teach you a lot about life and about how to be humble. They teach you a lot. It completely changes you. It changes your personality. It changes, as I tell you, how you face your day by day, and how you first face your job. When you go back, you appreciate what you have. And also, I see now, for example, all the doctors working in Gaza, and I can imagine that these people are giving everything just to treat patients with the worst conditions, with no sources at all. So I know what they can feel when I didn't even get close to the situation they have now. But yes, these patients give you something very special in reward that makes you want to do more and more and more. Yeah, and we always have to think that we never know if, as I told you, we always have to put ourselves on the other side. We never know if one day we have to migrate because the conditions in where we live are no good, or suddenly a war appears in where you're living and you become vulnerable. So we have to say thanks for what we have, and if we can, just help the other people that don't have the luck that we have.
That is so beautiful and so true. That's incredible.
It changed my life. It changed my life, and I would do it as many times as I could. Yeah. It's not easy. Like for me, it's easy because maybe I don't have family. I don't have maybe attachments to some certain place. So it's easier for me to move. But there's people with family that are doing this. We saw examples, as I told you, that they lost members of the family and they keep on going to the hospital and help people. So yes, it's something hard to describe, but I think everybody should do it. And any like volunteering is a different thing. Like it comes from your soul and you're doing it because you really want. Like not expecting anything in reward when you get a lot of in reward. So yes, I encourage everybody to do something like this once in their life.
So having said that, what advice would you give to somebody who's been in pain and maybe has been stuck for a little while?
I will always encourage them to search for help because pain can be treated. Sometimes we don't know where it comes from and it's difficult to treat because we don't know where it comes from, but there's always different options. Pain can come because of a psychological issue, pain can come because we have an injury, pain can come because we had a surgery, because we had an amputation. There's many, many causes of pain. We don't have an exact way of measuring this, but there's always something to do. Okay, there's always something. Maybe 100% we can't remove this pain, but at least to let you do a normal life, because pain can limit you in your social relations, in your family relations, in your mood, and in your work. You can avoid going out and staying home and getting recluded. It's like a circle. So we have to break the circle somehow. So it's important to search always for assessment. If it's psychological needs, if it's something that you need to, like there's a structural issue, like there's an arthritis or there's a lesion or a sport injury or something that you need to fix, there's always a way to solve this. As I tell you, like maybe we can do a nerve block, pain can decrease, and we can start with physiotherapy. Or maybe you were a runner and you had an injury and now you can't run anymore. We can help you. We can do maybe an infiltration with plasma, pain decreases, and then we can do physiotherapy, and slowly you can go recover and go back to your activity. If you have a lower back pain and you have a disc problem, okay, maybe they do the surgery and then you need a recovery. Maybe your pain is not 100% gone, but at least you can go back to your normal life. So there's always an option for pain. And especially now, I tell you, pain is advancing very, very, very fast. So there's many new techniques, radio frequency, there's many, many things that we can do for pain. So I always encourage them to go and search for assessment and don't reclude themselves at home and slowly avoid relations, getting depressed. We have to break the circle.
So that's amazing because it gives so much hope. Doesn't matter where you are and what's going on, there's still hope.
Yes, there's always, as I tell you, like even if we don't know from where it comes, okay, you can do different things and one day you'll find the cause, or at least you find something that relieves you. Okay, maybe you try with medication, it doesn't work. Maybe you try with physiotherapy, doesn't work. Maybe you underwent a surgery and you still have pain. But you can do, as I tell you, maybe you do radio frequency and it relieves a little bit the pain. So that's a window that we can open and try to help you recover a little better. Maybe psychologically you need assessment to recover. Okay, so yes, there's always an option. There's always a window to open.
That is amazing. Thank you so much.
Thank you for having me and hope people enjoyed the interview.
Thank you for listening to our podcast today. And if you have any questions about pain or physiotherapy, definitely reach out and Dr. Salima would love to help you. In the meantime, stay tuned for our next episode of FSHN Talks.